Uh, Welcome to this second session about Introduction to Environmental Health in the course Community-Based Participatory Research in Environmental Health. So on 18th, we gave you some brief background about environmental health, focusing on general environmental health, air, and water. Today, we will discuss in short about the soil pollution, followed by talk on climate change and health, and then built environment and health. And in last, we will finish by giving short information about social determinants, inequality in environmental health. All these area or topic which we have covered last time and what we will cover today, I think it will give you some more understanding about how problem in environmental health can be addressed when you will move to module second on CBPR, where you will actually learn different methods of CBPR. So without wasting any time, I will now start my presentation. On soil pollution. So this presentation was originally supposed to present by Dr. Satish, our scientist B, but he could not attend this session. So on his behalf, I am presenting this short presentation on soil pollution. So as we know that we have already covered air and water, so soil also play a very important function in shaping our health. So it is there are various uses of soil, and without clean soil, it is very difficult to maintain good health and well-being. So it is important for climate regulation. It helps in nutrient cycle. It is habitat for all type of organism, help in regulate the flood, and then source of pharmaceuticals and genetic resources. It is the foundation for human infrastructure. So soil has lots of function, and without soil we can't without good soil condition we can't have good health and well-being. So what is soil pollution? In simple words, soil pollution is the presence of toxic chemicals, pollutants or contaminants in soil in high enough concentration to pose a risk to human health and or the ecosystem. We keep hearing about various soil pollutants or soil contaminants in our neighborhood, in newspapers all the time. So what are the sources of soil pollution? The common causes of soil pollution or contamination or sources are dumping of different kind of waste. Now, in every cities, small or big, there is a dumping yard where the waste are dumped, and then many chemicals percolate in the earth, in the soil. Application of sewage effluent to the soil, that is also very common. Not every city in our settings are dispose sewage or effluent in good way. So this is also one of the factor for soil pollution. Application of excessive agrochemicals, fertilizers and pesticides. This is also very common. In some areas, it is very difficult to grow crop without pesticides or application of fertilizers. So that is, but in excess, these chemicals become pollutants. percolation of contaminated surface water to subsurface strata, oil and fuel dumping, leaching of waste from landfills, so ruptures of underground storage links, etc. So these are the different pollutants or source of soil pollution. Other issues with soil is like we have very intensive cropping, nutrient deficiency, loss of organic matter, water logging, salinity, imbalanced use of fertilizers, improper and excessive use of pesticides, and loss of biodiversity. So these are other issues with the soil. What are the effects of soil pollution? On environment, loss of soil productivity, surface and groundwater contamination, air pollution, greenhouse gas emission, food contaminations, loss of biodiversity and bioaccumulation and biomagnification. What are the health effects of soil pollution? Soil pollution increase the exposure to toxic and harmful chemicals. Living, working, or playing in the contaminated soil can lead to respiratory disease, skin disease, and other diseases. So, how we can control soil pollution? So, as we know that human activities are responsible for the majority of the soil pollution. So, one important thing is awareness among various stakeholders and people is a key to control the soil pollution, because soil pollution is not in that much agenda that what we hear about air pollution and water pollution. And then this is also very related to rural, the agriculture and farmers. So you can think about various ways how CBPR method can help in controlling aspect of soil pollution. It is also essential to understand the importance of soil and prevent soil pollution and stop the devastation caused to the plant, animal, and human life. The soil pollution can be controlled by proper solid waste and effluent sewage treatment plant, controlled use of agrochemicals, implementing afforestations, and then using 6R principle, that is rethink, refuse, reduce, recycle, recovery, and repair. It is very important that we should have a quantitative approach where we can monitor, assess the situation, but with the help of CBPR, which you will learn more in next sessions, I think there is lots of scope of developing research project or developing implementation using CBPR when it comes to the soil pollution. Then there are some issues which can be think of, like how the soil can be managed in good way, allocation of sufficient quantity of organic matter, crop rotation, intercropping, periodic soil testing and balanced fertilization, maintaining irrigation water quality, integrated pest management, integrated weed management. This is all factors. But the issue is that, as I informed before, that public awareness and stakeholder awareness are very important, and not everything can be solved in one go, but CBPR methods can be useful in giving information to different stakeholders in order to minimize soil pollution. So in last, healthy soil provides healthy food, and healthy soil provides nutrient cycle and pollutant breakdown. Soil help to mitigate climate change. So I think this is the area of soil pollution is quite important, because it is related to our productivity, it is related to agriculture, and it is also in a way help us in can help in, if we have good soil conditions, we can increase our productivity and can also reduce the soil pollution. So it is, I think, while when you will read this chapter in in our dashboard. Also think about how these can be minimized by using CBPR. Thank you very much. This was very short presentation, but if you have any questions related to this, you are welcome to ask, or if you want to comment something. Thank you.
Yeah. Good morning, Narendra here. Yeah.
Yes.
Yeah. So the one question is that, this is the one part of it, but in reference to the community kind of action, as we had some example during the water session. So are there some examples where soil pollution kind of thing is taken care of by community or people, or some management part of it is undertaken? Some examples, case studies.
As I told you, I'm not a soil expert, but I can tell you definitely there are instances which Indian Council of Agriculture Research are doing. For example, soil health card is one of the initiative done by the village panchayat in many of the village panchayat, many of the state. They are the first thing is that we are not aware about that this can be also can affect our health if we have not good soil. So soil health card is one of the area, and also there are many initiative which I can say not focusing totally on soil, but in watershed mission in many parts of the India where the plantation of tree are there, changing crop pattern in some part of Maharashtra, where I know where they have educated farmers to change the crop every time. And also in watershed mission, there are lots of initiatives has been done. But what I will say that still it's not in that agenda where we have the air pollution is known to everyone. So
currently we are kind of working with the natural farming or
natural farming. Yes, sure.
So
organic.
Is there any documentation from the institute or some evidences which are there in terms of health? The practitioners, especially the people like us who are working with around 20,000 farmers directly on community. So because mostly, people just say that, okay, if we start the natural practices, so 2-3 years it will take to soil to rejuvenate and all. But, it's in some cases where comes when people start doing it, it maybe they get a double production or enhanced production even in the first year. But so some evidence is there in the ecosystem which kind of give an encouragement for farmers to switch over to those practices. Otherwise, these practices are limiting to the, let us say, the small farmers. When we are talking about it's even a less than a 1/4 of the acre they will take, then try
sure.
it doesn't work, so then they will not encourage to go for kind of maintaining it.
So I think what you are trying to say that this is happening in small way. So the sustainability is a factor where we grow things in a way, in environmentally friendly way, but after 1 year, 2 years, then it stops. So definitely, I think government of India is also focusing on this organic farming and other thing, but awareness at local level is also very much important. Also, what we feel that the consumer awareness, which if I want to buy crop from organic or in which pesticide is not used, I am not much aware actually from where I can get.
I can understand, sir. I mean, it's like if some case studies can be shared in line with this.
Sure. That we will definitely share the case studies. Thank you. Don't remember now, but definitely in our area there where the farmers are rotating in Ujjain, are rotating there. So they are not growing the soybean, for example. So they are growing more the crop which are they are rotating the crops. So potato one time, sugarcane another time. So it also depends on the what type of facility, subsidies, and other things are available at those places. There are lots of things, but when we talk about, for example, how we can aware stakeholders or consumers using CBPR methods, I think not much has been done. It has been done in pockets, but not. But I will definitely share some studies and share to everybody. Thank you. Okay.
Dr. Tanvi here, sir. I wanted to add something to the discussion that was going on. There was a question about case studies on soil management and environmental interactions. So I would just like to give a short example of how ICAR's KVKs, the Krishi Vigyan Kendras, are kind of interacting with the farmers, particularly in Ludhiana and Punjab. So I can share those documents that ICAR has, reports that are there. So particularly because I was working in the field of crop residue burning, so I know that government has interacted with the farmers. So it's kind of a ongoing interaction about different mechanization like happy seeder and the other alternatives for crop residue burning. So that can be an example. So I'll be sharing that in the group.
Sure.
Yeah. Thank you.
And to add to that, Narendra, that there must be many case studies available in Sikkim. We all aware that Sikkim is the first organic state, and they have a organic farming policy also. If you are specifically interested in organic
Mountains.
farming thing, evidences, just look into that thing.
Sure.
Right? Thank you.
Thank you. And I was just contemplating in a line with because the KVKs or the other agencies, we do a lot of work with the government in collaboration. But challenge is like the soil health, we will go for the macronutrient kind of assessment, not the micro. And nowadays is the time when we are talking about the soil health and all, we have to think seriously for making it easy, kind of for farmers to understand the micro assessment as well. That is also of crucial importance. Yeah.
So that is why this CBPR will come in the picture, that how easy way we can inform these things to the stakeholders.
Yeah.
Thank you very much. So now for the next presentation, I will invite Dr. Madan Raj, who is currently working in ICMR, National Institute of Epidemiology in Chennai, working as scientist D, and he will talk about climate change and health. Over to you, Dr. Madan Raj.
Hi, all. Good morning, everyone. So, sir, let me share my slide. Is it visible, sir?
Yes.
Okay. Good morning, everyone. For the next 10 or 15 minutes or 20 minutes, we are going to discuss on the topic climate change and health. I'm Dr. Madan, scientist working as scientist from ICMR National Epidemiology, Chennai. Let us begin with what is climate change. Any change in climate over time, whether it is due to natural variability or as a result of human activity, is called climate change. This is the definition given by Intergovernmental Panel on Climate Change. And UNFCCC, that is United Nations Framework Convention on Climate Change, defines it as a change in climate which is attributed directly or indirectly to human activity that alters the composition of global atmosphere, and which is in addition to natural climate variability observed over comparable time periods. Concentrate on the keywords like either directly or indirectly and human activity. So human beings are doing something which affects directly or indirectly some composition in the global atmosphere, which cause the whole problem. which cause the climate variability. And how are we going to define? We are going to define that by comparing different time periods. Okay. See here, there are three graphs here showing changes of some parameters over 1,000 years. Parameters like carbon emissions, carbon dioxide concentration, and temperature change. You can very well observe that post 1800, there is a rapid increase in carbon emissions and corresponding increase in carbon dioxide concentration in the atmosphere, followed by the increase in temperature, Earth surface temperature. So post 1800, that post we can call pre-industrial period, and post 1800 is the post-industrial period, or after industrial revolution. There is an excess increase of carbon emissions or fossil fuel usage, which result in carbon emission and increased carbon dioxide concentration accumulation in the atmosphere, which is resulting in the temperature change, Earth surface temperature change. And it is proven clear cut. The IPCC is 199.9% sure that this increase in temperature cannot be explained by the natural process. So already the global surface temperature is around 1.2 degrees Celsius higher than the pre-industrial level now. And this gradual increase in Earth surface temperature observed since the pre-industrial period is what we call as a global warming. And this is due to the human activities. As I already told you, human activities led to accumulation of greenhouse gases, which result in exaggeration of naturally occurring greenhouse effect, and which in turn it causes the global warming. I believe we all know the basic concept of greenhouse effect. Let me refresh it. Earth receives solar radiation reaches the Earth surface. Majority of the Earth solar radiation is absorbed by the Earth, so that the Earth surface gets heated, and eventually heat radiates from the Earth towards space. And this radiated heat is somewhat trapped by the greenhouse gases in order to keep the Earth warm enough to sustain life. What happened in the post-industrial revolution, that human activities caused increase in this amount of greenhouse gases, the gases which trap the heat in order to keep the Earth warm for sustainability of life. That amount of greenhouse gases increased, and this exaggeration result in extra trapping of it, which is causing the Earth surface temperature to rise, causing global warming. So literally, climate change is affecting every inhabited region across the globe, and where there are various impacts of climate change in various forms, like increase in the frequency of heat waves, cold waves, change in precipitation pattern, either in increase or in a decreased frequency, or in a different seasonal time, and extreme weather events, melting of glaciers, rising sea levels, and this cause air pollution, water scarcity, etc. So these climate impacts are eventually going to affect the human health either directly or indirectly. Indirectly, it could be ecologically mediated or socially mediated, causing ecological disruption, or eventual that followed up social social and economical impacts also affect the human health indirectly. And the spectrum of health impacts due to climate change, even though it may not be quantifiable, or it is very difficult to quantify, it is very high, ranging from normal infectious diseases to non-communicable diseases, and even to that mental health disorders, etc. So how the pathway, as I already told you, climate change is having either direct or indirect impact. So the climate impacts like increased temperature, precipitation, change in precipitation extremes, extreme weather events, sea level rise. These are some of the climate impacts is going to alter the exposure variable, like that extreme heat may cause poor air quality, reduced food production, water quality, and the changes in the characteristics of the infectious agents, vectors, etc. And which is going to result in an adverse health outcomes in various form. As I told you, the spectrum is very broad and wide. And there are two boxes in that side of this, the two boxes, which is showing about the environmental and institutional context. Is kind of this climate impact is going to affect this environmental and institutional context as well, and the social and behavioral context as well, which is going to result in a differential exposure level and differential health outcomes among various people living across the globe. An example, like for example, we have a more frequent and severe prolonged heat events. We are feeling that, right? The summers, in during summer, we feel that every day is hotter than the previous other day or previous years, etc. So this results in exposure to elevated temperature and results in heat related illness and death. Similarly, increase in temperature and changing in precipitation pattern causes poor air quality, increase in ozone particulate matter, or higher pollen counts, which is going to cause acute and chronic respiratory and cardiovascular morbidity and mortality. And same for other impacts as well. The impact is going to alter the exposure, and this exposure is going to affect the health outcome. So it is epidemiologically or scientifically, it is very difficult to establish the link between health outcome and the climate impact. So there are various indirect ways that people do correlation, etc. So though the indicators of the climate driver and impact is an idea for the health planners or decision makers, so that they can expect this kind of health outcomes will come. So understanding of this link is important. In that point, CBPR may help us to linking what are all the climate drivers and how this is going to alter the exposure variable, how it is going to affect the health outcome, and how this is going to affect different sections of the population. That is the place where we are going to apply CBPR. So the coming next slides are going to be little bit technical, how this climate change is going to affect impact cause infectious disease. For example, this is the epidemiological triad. The interaction between agent, host, environment, and vector is going to it's going to cause infectious disease. For example, any imbalance in this interaction going to cause the infectious diseases. The climate change is going to affect each and every aspect of this triad: survival, reproduction, distribution, transmission environment of the vector and agent, etc. It is going to affect, which is going to result in that shift in the seasonal pattern, shift in the geographical distribution, changes in the outbreak frequency, severity of the infectious disease. You can see here from 19, there are two graphs here. First graph shows from 1950 to 2018 how the dengue climate suitability changes. So from 1950 to 2018, the global climate suitability for transmission of dengue increased by 8.9%. Similarly, in 2015 to 19, suitability of malaria transmission in highland areas was 38% higher in the African region and 150% higher in the Western Pacific region compared to the 1950s baseline. So compared to 1950s, now we have the climate suitability of transmission of these kind of infectious diseases are very high, and we are going to see a very difference in the geographical distribution, seasonal pattern, etc. And about the climate change is also going to affect the survival, reproduction, biting rate of the vectors, and a pathogen extrinsic incubation period. That is how the pathogen is, how long the pathogen survives within the vector. That is a pathogen extrinsic incubation period, pathogen survival and reproduction. So these all things are sensitive with the temperature or climatic variables like temperature, precipitation. So when there is a variability, these things are going to change. Eventually, the distribution, incidence, and severity is going to change. And another important aspect of climate change regarding infectious disease is that it is going to facilitate zoonotic spillover. There are n number of organisms circulating within the wildlife, and the climate change is going to affect the animal and wildlife conflict eventually, and that is going to result in the zoonotic spillover. Here there are three steps. One is the pathogen pressure, which is nothing but the role of pathogen within the animal wildlife. And second thing is that how the pathogen released from the this reservoir to the human, and then exposure of human beings. All these aspects, some sort of climate change is going to affect in future, and is we are going to witness many new infections, novel infections, etc. And as we already discussed, extreme heat is going to cause more morbidity and mortality in recent times. So we are witnessing multiple heat wave episodes, and there is an evidence that from 2000 to 2018, heat related mortality in people older than 65 years increased by 50%, and significant increase in premature heat related deaths is also reported. So days that are hotter than usual in the summer or colder than usual in the winter are both associated with the increased morbidity and mortality. The point to be noted here is that when we talk about climate change, or intuitively we think about the extreme weather events like flood or some kind of natural disaster kind of thing is a most common thing, and the health impact due to that natural disaster is only happening. That is not the case. Actually, more than that, the increase in morbidity and mortality due to this minor, a small difference in seasonal average temperature is also a significant burden, which we have to note, and we have to, as a policy maker, as a health profession, we have to think, and while preparing to deal with the health impacts of climate change. And air quality impact, that is also already discussed, that climate change is going to affect the air quality. The ground level ozone pollution is going to increase, which is going to cause many morbidity and mortality. And wildfire, the incidence and frequency of wildfire, forest fire is going to rise, and that is going to cause acute cardiovascular and respiratory health outcomes. And increase in the pollen, some airborne allergen is going to rise, and the increase in diseases like asthma and COPD and other allergic diseases are going to rise. Another important thing is, which is already discussed in soil pollution also, this going to affect the food productivity. Already the global number of undernourished people is projected to increase to 840 million in 2030, and this is going to the climate is going to exacerbate the impending crisis. That is what going to happen. The crop yield is going consistently downtrend, and eventually we are going to end in food. So the problem is going to happen in food security, and undernutrition is going to flourish like anything. Another problem is that migration and displacement. As we all know, various impacts of climate change eventually will cause major migration and displacement and relocation due to rising sea levels and other extreme weather events. The huge health consequences is we can expect across the spectrum, from acute level, chronic level, infectious, NCD, mental health issues, etc. And the very much high burden to health system is about to happen. We need to prepare for that. Without any intervention, 565 million people living in coastal areas today will be affected by rising sea levels in the future. So, after discussing this health impacts of climate change, let us discuss about the concept of vulnerability. How a population, how a community, how a person is vulnerable to this climate change. There are three different variables which actually determine the vulnerability of human health to climate change. One is exposure, sensitivity, and ability to adapt. So, what is exposure? Exposure is the contact between a person and the environmental stressor, or any stressor which is related to climate change, etc. For example, the change in temperature, higher temperature, or continuously higher temperature, or increase in frequency of heat waves, etc., is the exposure. When sensitivity is a degree, how we respond, human beings or community respond to that exposure, and ability to adapt is the adaptive capacities of the community or a people to the potential hazard. So these three factors interact and determine the vulnerability, and which in turn going to determine the health outcomes. So see here the exposure. For example, so who is vulnerable, who is at risk? If you want to prioritize our prevention, our mitigation strategy or adaptation strategy, we need to know who is at risk, who needs more resources, right? So the people like lower socioeconomic group people, or underprivileged people, and people from some occupational group, people living in some locations, they are specifically have the differential exposure. They may have more exposure to the climate impacts and that in turn affect their vulnerability and health outcomes. Similarly, some group of people are sensitive to the impact or exposure, like pregnant women, children, people with pre-existing medical conditions are very much. For example, if there is a mild increase in the pollen count in that in the atmosphere, the already pre-asthmatic, the exacerbation of asthma may increase among the children. And similar for the pregnant woman, it is very difficult for them to cope up with that extreme heat, etc. So these people are vulnerable. Again, another thing is that ability to adapt. People like assume there is a flood, the flood, and the people need to rehabilitate, or during the rescue period and rehabilitation period, people, elderly, differently able people, are it is difficult for them to adapt. So, and similar for the native and indigenous people, if uh, the adaptation measures or the mitigation is measured going to relocate from their own place to some other place, it is difficult for them to adapt. So these are all the people at risk, vulnerable. As a policy maker, as a advocate to the health, as an advocate, health policy advocate, we need to think about all these things. And as I told you, some factors are going to cause a differential exposure and results in differential health outcome. And see the inequity. This picture clearly shows who are the responsible for the climate change, and who are all affected by it. So someone is created some problem, or continuously creating some problem, and some poor people or underdeveloped countries, third world countries, are being affected more because of the impact of climate change. You can see the size of United States of America in the map 1, and size of Africa in map 2. So they are the polluters, and these are the people are getting the impact of health impact or any other impact of climate change. So what we have to do, mitigation and adaptation measures in a very emergency or ultra emergency mode. Mitigation is nothing but doing actions or activities to reduce the greenhouse gas emission, so that we can reduce the climate change itself. And adaptation is that we expect some amount of climate change is already happened, and we need to adapt to prevent it from the impact of that climate change. So that is adaptation measure. And who has to do this? It is not a each and every individual has a moral responsibility to work against this. However, to see a meaningful effect, we need a global integrated action required to adapt the mitigation and adaptive measures. And we know how this whole politics is going on across the globe, from the Kyoto to the Paris Agreement. We all aware about that. That is not scope of this talk. We can talk about that some other day. So if at all we adapt, we start our mitigation and adaptation now, what will happen? See, there is a baseline burden, and this slope shows the potential health impact of climate change. If mitigation begins now, we can avert, the health impact will be averted. This much of health impact will be averted. And along with that, the mitigation measures have that positive externalities, other benefits, health co-benefits, that is also going to reduce the baseline burden itself. And along with adapting the adaptation measures, we can also avoid the remaining health impact as well. So people, I mean, in the global leaders has to act at the uh, utmost emergency. Thank you. And one more point, and one last couple of points is that, so what we have to do from health, I believe we all, the participants, are also somewhat related to the health system, health professionals, or health managers, program managers. Pardon? Hello?
इनसे बोलना भेजेंगे, कल से गई है, आई नहीं है.
Somebody has to mute, please.
Okay, so as a health professional, what we have to do, or a health program manager, what we have to do, the comprehensive assessment of climate risk to health and health system is to be done. That is also the proper assessment has not yet been done, and because of various reasons. We need an integrated environment and health surveillance. We are talking about One Health, right? We have to integrate, even One Health is also not happening. So we have to integrate this climate risk into that One Health component, and We need a integrated health surveillance thing and delivery of preventive and curative interventions for identified climate sensitive public health concerns to the last mile. This is very important. The concept of universal health coverage and the reality of universal health coverage is very important, because as I told you, some section of people are going to get affected very much more compared to some sections. So poor are going to get poor people are going to get more affected because of this climate change, even though they have not contributed to the problem. So last mile delivery of services is very important, and building climate resilient and low carbon sustained health system is also important. And preparedness and respond to the public health consequences of extreme weather events. Applied research in this area, we have to do more and more applied research and strengthening of human and institutional capacities to address the health impact of climate change. And so as an individual, we can adopt pro-environmental behavior to reduce our carbon footprint. And as an uh, health researchers, we can choose this field and do various applied research and generate evidences. As a teacher, as a learned person, we have to create awareness, transfer knowledge to other people. And as an activist, I believe we all should be an activist, and we have to raise voice for this uh, the problem which is very much neglected. So we have to raise our voice against the problem which we are going to face. And I think this is the greatest or biggest health threat we are going to face in the 21st century. And what is the role of community-based participatory research? In the coming weeks, you guys are going to learn about very interesting techniques, which is going to take you very nearer to the community and understand their perception, what is their felt need, and what are the resources they have, and how that resources can be efficiently utilized to deal with the health problem, right? So this the you so the learning of CBPR is going to help us more in addressing the impending health issues, impending environmental health problems. For example, the disasters for the coastal areas, coastal villages, etc., are very prone to the floodings and etc. You can use the CBPR technique to develop a disaster reduction strategies. The community, village level plan, what are the prominent disasters they are going to face, that every year they are facing, and what are other strategies at their level they can make. That kind of plan, CBPR is a tool which we can use, and they can make that plan. So that is one a quick example. So basically, intervention required is at local and context level, but that is not happening. That is a gap. We are going to address this. This requires the adoption of more local and context sensitive approach, and the CBPR is going to help for that. And that's it from my end. Thank you. Any open to question, any queries?
Yeah, I think thank you for this presentation, sir. I think it's again a very debatable kind of things which climate change and whatever we mostly now we are talking about, because it's like, you know, the institution or the people like us who are working on directly on the community based on the experiences, like, you know, working with the farmers, working with the indigenous communities, working with the tribals. But what we noticed is it's more of like we are destroying the systems which are good or what we call the eco-friendly or a climate preventing that kind of stuff. And now we are talking, and the context is becoming more of global. Like it's not it's becoming a country specific, region specific as well, and it's becoming a global kind of thing. So where to how to measure that gap and say that, okay, this is the gap, and then do intervention. One is a local level, but how much significant it is. Like if I'm working in a district and there I made the farmers to go for the best practices or the soil management or, you know, the other things. But I know that I'm sitting in Dharamshala in Himachal Pradesh. So it's like the 3 days it was a big hot summer kind of thing. And today the people are like switching over to the kind of jacket. So just in a 3 or 4 days kind of thing. This is not how much this is related to those kind of direct control from the local end intervention? Or is it not the global, like we are talking about the AI now, artificial intelligence? The same we need to talk, come up with a very firm political will and those kind of
Yeah, of course.
decisions. Yeah.
Of course, Narendra, this is a problem at global level and also local and contextual level. The major action, for example, the significant reduction in greenhouse gases are not going to significantly affected by our individual or local action. The policy level actions are needed, and it is a very big politics. If we enter into that thing, how are we going to reduce, whether it is pertinent, whether pertinent for a developing country like India or other developing countries to enter into that policy is a big debate. We may not enter into that, but I believe local and contextual action, understanding about this, the impending issue, and taking a eco-friendly or climate friendly or reducing carbon footprint local action you may not able to see the impact very soon. It is not a direct cause effect relationship we can demonstrate, but we need to have an intermediate proxy. If you're doing a organic farming or any eco-friendly activity, that must be intermediate proxy. You can indicate, you can say that this is improved, so that eventually this can achieve that a larger bigger picture. If at all if you are able to demonstrate at your village level, and if you demonstrate the scalability of that particular thing, and objectively you have demonstrated the improvement in that intermediate indicator, that is going to be well accepted by the policy maker, if at all that is cost effective, etc. So then that action, that intervention will be scalable, and that is also possible. But it is up to the priority of the government, Narendra. You can see the countries like Bhutan. It is always a debate between development and environment, right? So how much we are ready to do that, how much sustainable development concept that we understand, that is the solution. Actually, sustainable development is the solution here, I think so.
I think, yeah, the cost element also, like when we look into the kind of havoc which is created by and being created by the climate change issues. I mean, where the cost again become a very kind of thing, tricky thing, that how it is we are going to measure the cost, because that cost may be multiplier
Yeah,
in terms of this. And last thing is local, when see mostly when we are in the community or we are working with the community, it is more community is automatically adapting to the changing thing. Like let's say the wheat harvest season is going on, so now people know that how to protect their crop at this juncture with the rains or hailstorm which is happening, because they have to go for the harvesting now. So that is an adaptive kind of approach from communities happening, but not a preventive and proactive what we usually envision in terms of doing it, right?
yeah, I agree. And as you already discussed, a preventive kind of thing is more policy related. If at all I have a subsidized solar panel, the behavior of solar energy at my house level will be increased, right? So that the policy of very subsidized easy availability of solar panels is a policy dependent. So then only that prevention kind of thing happen. So the adapt, as you rightly pointed out, we as a community can plan for adaptation. As I told you, the CVPR technique which you guys are going to learn is going to understand and very much useful in making the adaptation plan for various health impacts or climatic impacts. I agree with
Thank
you.
you. I think others,
Thank you.
I
Thank
just
you.
don't want to kind of asking all the question. Please
No,
open
no,
for
no problem. That is interaction is the essence of this thing, right? The lecture should not
thank you.
be a monologue. Hmm. Any other questions? Open to you.
Sir, I have a I just to know a clarification regarding one of the slides that you have shown
Yeah, please.
with regards to the decline in the graph. Is that out of any kind of research happened?
Which graph do you want me to
Sir,
share? That
the anticipated vulnerability
that
reduction. Yeah.
that is a kind of predictive model kind of thing. That
Okay.
the graph was originally published in Lancet in around 2005 2006 period. So
Okay.
that thing is that basically it is a assumption. Based upon the assumption, they have made a predictive model. For example, based upon that IPCC report, this much health impact would happen if at all there set 1, set 2, set 3. These are the mitigation measures, and
Yeah.
set 1, set 2, set 3 are adaptation measures. If you adopt this much, health impacts can be averted.
And also, I just also wanted to add some more things to that, like, the involvement of local context or local community in the disaster management. I belong to, the most disaster prone, I would say, the state in Kerala. I'm from Kerala. So we
Oh.
have been facing flood. We have faced, a lot of disaster, natural as well as man-made. So in flood, what we have seen is a very beautiful kind of a very local as well as the multi-stakeholder partnership, I would say. Like, the fishermen community from a few districts apart came all over with their all the equipments to just take care of all the people who are affected with flood. And also after the flood, what I have seen, one of the important conference conducted by the Kerala Disaster Management Authority, they have included children in formulating some of the mitigatory measures or the adaptability measures. And one of a child drawn a picture like how his house could have been made, and so that he can avoid the other kind of, if any kind of flood comes in the future era. And it was so beautiful, and it was well appreciated by the Chief Minister. And I thought I would share this thing among you people. Yeah, thank you.
Interesting, Rajimol. And this is the thing which you explained is exactly what you are going to learn for the next 2-3 weeks through the CBPR, and I'm looking forward. Okay. Thank you.
Thank you, Dr. Madan Raj. I think we move to the next presentation. So we need to extend this session for maybe 10-15 minutes. So because 2 sessions are remaining. So now I invite Dr. Yogesh Shabde, Scientist F in ICMR NIRE, to talk about built environment and health. Dr. Yogesh Shabde.
Thank you, sir, for this opportunity to interact with so interactive participants. And I will start my presentation. Am I audible to you all?
Yes.
Okay. And slides are visible?
Yes.
So good morning. So I will be talking about built environment, and most of you must be wondering what this built environment is doing here and how it matters in this context of community-based participatory research, particularly in the area of health. So in the first few slides, I will try to introduce you with this concept, and then you will come to know that it's the same thing that we are studying so far. So let's look at these 2 slides. We the humans, whenever go near to the nature, we immediately start modifying it to make it safer for us. So depending on the availability of resources and our capacities, we modify it. For example, you can see a small hut made up of woods and sticks. And second is my where I could afford this tent, so I built this tent for myself. And most of you will agree that without having such modifications in the environment, it is practically impossible for organisms like human beings to survive. And that's why it is not only a comfort or luxury anymore, it is a necessary for human beings to survive in the nature. And knowing or unknowingly, it has become our ultimate dream. So when you go to any school and ask children to make a place, scenery or something, most of them will make a drawing like this. And this drawing contains one important structure that is called as their home. We can name this exact structure in different ways that we dream about. Some people call it as a hut, some call it as tent, some people home, some people building, some people call it as our township or our village or city or whatever you want. But you can see that there are some important structures by and large in this diagram or in this picture that we always dream. There is a structure that protects us against the environment. There are also some other structures that give us space to actually recreate, play, and do our work. There are also some spaces that give us the natural resources like sunlight, the water, and many more things. And that's how this is kind of our basic instinct that we are dreaming right since our childhood. But when we dream, start running towards this dream, we try to earn some money, we try to earn some resources, and you must be agreeing with me that we spend at least 50% of our savings, our resources, or even debts on building the structure that we dreamed since our childhood. But what happens in reality? Most of the time, we fail to manage it in the way it should be managed, and we end up in the way that you can see on the right-hand side diagram. This built environment, which was actually supposed to protect us from the nature, becomes enemy of the nature itself. And ultimately, then the nature fails to protect us, and then we'll end up in the problems such as climate change, pollution, and whatnot. So that's why it was wisely quoted long way back by, I think, Winston Churchill, that first we shape our buildings and thereafter they shape us. And that is the reason why we need to focus on this particular concept that has been labeled in the literature as built environment. And you must be agreeing with this, why this concept is important for us. So while scientists were trying to define what exactly constitutes our built environment, so there are many more. It is not just one structure that we build. It's not just a small hut or a small house. It is actually a complete system. It's a completely battery of multiple simultaneously functioning systems that constitutes actually our built environment. And this diagram, actually, this flow chart will actually tell you what exactly means by built environment. But I'm sure that there are many more things that also come under the era of umbrella of built environment. So let me just try to enumerate a few. So as per literature, built environment has been defined as all man-made spaces where we live, we recreate, and we work. So just imagine what are the places where we live. They include the buildings, the huts, the townships, the bungalows, or whatever you can imagine. They are always surrounded by parks, and they should be, ideally, I'd say, they should be surrounded by parks, green spaces that will actually give us some fresh air, fresh sights, and some spaces to work out, etc., etc. Then there are also some neighborhoods and cities that constitutes the other people residing in those spaces, the facilities, the amenities available there, and the places that give us opportunity to travel. Then they also include some spaces that some supporting structure, because for the primates, the water supply was, say, kind of natural thing. But as we know that the population is growing, then we have to ensure that each and every house has a water supply. So we have to develop water supply system. There are evidences that these water supply systems were there even in the ancient cities of Mohenjo-daro and whatever you know. Similarly, the drainage system is really important to take out all the waste products that we generate in this built environment. Then in the modern era, since the last 200 years, we are also dependent on the energy networks. So we need electricity, we need fire, we need cooking fuel, and even the driving fuel. So all these networks should also be enabled in this modern built environment. So as we go on evolving on and on, we need more and more supporting structures. For example, in this particular definition, mobile network is totally missing. But you can know that without such mobile and internet network, we wouldn't have been able to meet each other in the meetings like this. So accordingly, this definition of built environment is constantly going on and on. Then there are also some other public health attributes. So it is not only our own house that is sufficient. Now, in this era of Zomato and Swiggy, many of the people are not able to make their food at their own home. So access to healthy food, that is another important aspect of built environment. Community centers, community gardens, and get-togethers, they are also important because that is the place where we can have the activities like community-based participatory research. So these can be the community halls, the temples, the mosque, or whatever you can say. They also make a social environment in the simultaneously in the built environment. Then there are also other things that are important for modern challenges like non-communicable diseases like walkability, the access to gym, access to areas where we can work out. So you can just, this is just an introduction for the definition, but this doesn't include, means it is not possible to mention everywhere in this single slide. So finally, I would like to say built environment encompasses all the man-made spaces that we have made for our own survival, our comfort, and our productivity. And that's how you can know that this includes actually everything that we are seeing around, except and this excludes only those places which are not yet been touched by man. For example, some deep trenches in the ocean or some of the non-accessible mountains. So that's how built environment has a very wide scope, and it has direct impact on our health, well-being, as well as productivity. Because if built environment is not properly planned, it will directly affect the nature and directly affect our health. So let us see some of the examples how built environment influences our well-being and health. So if you look at the say, if you go back, say just 100 years ago, this is the left hand side picture is a picture of one of the developed countries in the Western world. Over the period of time, they started getting industrialized, and they got money, and they started investing in their built environment. And now their built environment looks like the picture on the right side. I'm sure that many of our young aspirants who have talent in them dream of getting settled into such countries where the built environment is proper. If you are given an option to stay in a remote rural area and a developed country, many of you by and large will opt for the developed country. And this is because everybody wants to have a better quality of life. What happens because of this? All the talented people get accumulated in these better built environments, and then they make it further better. So that's how it goes on adding. And as it has been shown by one of the slides by Madhadraj, that is how the carbon footprint and the impact on climate varies from developed country to less developed countries. So this is how built environment plays a multi-factorial role in development. Let us see how it influences the health. So these are just some of the mechanisms how it affects. So look at the left side. If the houses and built environment are not having adequate ventilation, or there are vector breeding places in the houses, or there is lack of safe drinking water and sanitation, what will it do? It will lead to infectious disease. For example, poor ventilation will lead to respiratory infections. Lack of safe drinking water will lead to gastrointestinal infections, and so on, vector-borne disease infection, etc., etc. This is not the thing. Second thing is, on the right-hand side, you can see if there are lack of essential services. For example, there are no open spaces for workout. There are more unhealthy food outlets, or there are no access to transport facilities. This will lead to unhealthy attributes. For example, if there are more tobacco shops in the particular facility, the young ones are more likely to get addicted to tobacco. This has been documented by studies. Fast food outlets will also lead to more unhealthy food eating habits. So these will affect the behavioral risk factors, and this behavioral risk factor will lead to non-communicable diseases like cardiovascular disease, cancer, mental health, accidents, etc. How accidents have a potential? Built environment also includes the roads and transport facilities around the houses. They also, if the roads are not safe, they will lead to more of the accidents. If the houses themselves have more accident-prone places, darker corners, or the staircases are not having rails, etc., etc. So these things also lead to more amount of accidents. So that's how built environment have a direct impact on communicable as well as non-communicable diseases. But apart from this, built environment has some indirect linkages with the health. For example, if built environment can facilitate exposure to environmental hazards, it can also lead to climate change, air, water, and soil pollution, and this can again act as a catalyst for infectious as well as non-infectious disease. It also acts through some social problems. For example, if there is inadequate light and there are inadequate safety points on the road, This will lead to lack of safety for women. It will lead to more crime in their neighborhood, and this will lead to actually loss of jobs for women. And this will actually ultimately affect the women empowerment. If the built environment is not having access to schools, it will directly affect the access to education, and children will not be able to go to school, and their or if the access is difficult, they will spend more time in traveling and going to school, and on this travel they will be vulnerable to many other problems. So in that way it will affect their education. If the built environment is not having access to physical activity areas, they will influence the growth and development of the children. So there are many other ways we how in the you can imagine how built environment can affect social problems, and these social problems will create weaker children. Weaker children will with less education, and this less education, less educated society will ultimately lead to less empowered society. And the worst affected will be the women because they are usually disadvantaged by this access to all these facilities. So these are some of the studies that I would like to discuss. Like Anderson J in 2018, they actually developed a scale to see how the homes, how safe the homes are. And according to this, if the houses are having more problems, the children were more likely to have gastrointestinal infections. Then Ramani et al. In 2016 said that inadequate housing conditions had higher risk of respiratory infections. I came across more than 39 studies who has reported that housing improvements can lead to improved health conditions. And maybe because of these studies, World Health Organization also documented in one of the reports that majority of the deaths among under 5 children could be prevented through built environment improvement actions, such as improving access to clean water, reducing exposure to air pollution, improving sanitation and hygiene, and reducing breeding sites for mosquitoes. And you all must be agreeing with all this. So there is also link for, there are also some studies that prove the linkages between built environment and non-communicable disease. For example, in Mazdi in 2018, shown that fear of crime and stranger and parental support and perception of traffic were environmental factors influencing children's independent mobility. What is children independent mobility? It is the possibility that a child will go out of his home for play or for any travel alone. And if the child is not, if the environment is not safe enough, you can also say that many parents don't allow their children to go out and play on the with their friends just because the outside environment is not safe. If the children are not able to play, their physical activity will be reduced, and you know the consequences. Then Bilal in 2018 showed that socioeconomic status and built environments are associated with prevalence of diabetes also. So it is directly associated with the physical activity. We recently did a study in Bhopal where we actually enumerated all the tobacco outlets in a particular neighborhood, and then tried to, in 32 neighborhoods, and then tried to correlate it with the prevalence of tobacco use in the vicinity. And we found a significantly high association between tobacco shop density and the tobacco use prevalence. This mechanism can be acting other way also, that it is possible that there is high demand for tobacco, and that's why there is high density of tobacco shops. This is how that the behavior of community direct impacts the built environment, and built environment later on affects the behavior of community. Because many of these tobacco shops were located within 100 meters of the schools, that is against the act that is called as COPTA, that is already prevalent in India. Many of these tobacco shops were having children less than 18 years who were buying tobacco. So this is how the behavior of community is also influenced by a small attribute of built environment, that was a tobacco shop. In this way, you can see that there are many evidences, and let's keep this component of evidences and go to the next slide. So let's say who are the most vulnerable people for built environment threats. They are the elderly, homemakers, and children, because they are the people who spend most of the time in the built environment. And then the occupational groups, for example, the working population. Suppose the offices are not adequately safe, it will directly affect the working population. It is not only offices, they are all working places. It can be workshop, garages, and even farms, whatever it can be. Then the users of built environment because of their directly behavior, and most important are the migrants because they are the people who have actually lost their the built environment that they themselves made for, and now they have been shifted to all new environment. For example, a rural dweller who was so far working in a farm and in the fresh air, he has suddenly shifted to an urban city. Now that rural dweller has been exposed to all the pollutants, and they are also not having any house there, or whatever house is there, it is not adequately, it is not adequate to protect them from the environment. And that's why these are the most vulnerable components of the population. And then climate change population, these are the population residing in the, say, flood prone areas, coastal areas, or mountains, because the whatever built environment is there, it is actually failing to protect them. And there are many more where more evidences can be generated. So what is the role of intervention in this? So this is one of the mechanisms I have tried to explain. If the housing conditions are poor, it will lead to social inequity, will lead to environmental inequity, health inequity, and there will be poor quality of life, and the people will become more poorer. The poorer people will not be able to actually develop their houses properly or even maintain their houses properly. Because of lack of maintenance, this environment will again not be able to protect them adequately, and this becomes a vicious cycle. If by some intervention we break this vicious cycle, these improved housing conditions will improve their health, they will protect them against the environment, and that will actually reduce their, improve their productivity and reduce poverty. With this reduced poverty and improved productivity, the people will be able to invest more in their built environment, and then their health will be sustainably improved. So this is one of the mechanisms, and that is the reason why 3 targets out of in the Sustainable Development Goal 11 are associated with improvement in the built environment. For example, 11.1 says that we have to ensure access for all to adequate, safe, and affordable housing and basic services, and we have to upgrade the slums. 11.2 says that we have to focus on the road transport, sustainable transport, and improve road safety. 11.6 also says that it is not only that we have to make it favorable for us, but we have to also reduce the environmental impact of the cities. Apart from goal number 11, goal number 1, 3, and 6 are also connected with the built environment. So looking at these important goals, Indian government is also investing heavily in improving their built environment, but these efforts actually date back to the since our independence. As soon as we were independent, there was a huge problem of refugees, and government has built more than 5 lakh houses for them and provided them. So let's keep these historical parts, come to the latest proceedings. You must have been heard or seen this logo of JNNURM, that is Jawaharlal Nehru Urban Reforms Mission, under which there are many sub objectives or submissions. This has already focused on multiple factors like road transport and safety, etc. But I would like to focus on this particular scheme, that is basic services for urban poor. This scheme actually, what it does, it develops a house of 400 square feet and it provides it to the slum dwellers. And then they actually relocate the families to these new houses that are built according to norms, and simultaneously care is taken care there that these houses are having adequate water supply and sanitation facilities. So far, according to my records, more than 11 lakh 35,000 houses have been completed, 10 lakhs have been already occupied, and many more are in progress. The scheme was launched in 2005. Thereafter, this another scheme is also there, that is Pradhan Mantri Awas Yojana. This is also available in urban as well as rural areas of India, and this scheme takes care of 5 points. That is, the houses should be all-weather protective houses with clean water, kitchen and electricity and toilet facility. There should be a component of women empowerment, and these houses are actually kind of subsidies given to the families to build their own houses, and these subsidies are transferred in the name of woman member of that family. This ensures better quality of life and give it a more secure and better environment. And these schemes are always linked with other schemes that are important for built environment. For example, it's a mandate to make a toilet in these houses before releasing the grant, then access to drinking water is always given in these places. Electricity connection is also there, and this LPG connection through Ujjwala Yojana is also provided to these houses. So it is kind of integrated scheme to develop all aspects of their built environment. Then you must be already aware that smart city projects are already ongoing in multiple cities of the country. In Bhopal, that where we are actually staying, smart city project is also going on, and according to my literature search, more than 2,900 projects are ongoing, and more than 50,000 crores have been invested. In the previous scheme, that was JNNURM, more than 26,000 crores have been invested. So with this, let's come to the topic that what is the role of community-based participatory research in this? Because it is not only the government that can play a role. These houses can be constructed by the government, but the community has to maintain it. And you know that the built environments are the things that are built by human beings, and they keep on changing constantly in response to the action from residents. For example, I told you the example of tobacco shop density. Tobacco shop density is firstly determined by the demand of tobacco in the community, and subsequently keeps on influencing the prevalence of tobacco or use of tobacco by the young ones. So that's why we have to take an account of built environment components that are available. If there is a gymnasium available in the community, people are more likely to go for gymnasium rather than tobacco shop. So that's how we have to take informed decisions while this. And this can be not only done by giving access, it has to be also influenced by community-based participatory research. So it is not only that we are giving them only lectures or only facilities, both of these have to be given simultaneously, and we have to simultaneously understand also what are the problems why people are not getting engaged in the healthy behavior. So built environment must promote or at least allow for engaging in healthy behavior. Suppose if I want to go for walk, there should be a space for walk. That's always the reason. So what is the importance of why this needs to be discussed in more wider forums? There is an article published in American Journal of Public Health, which says that whenever major decisions about built environment are taken, the panelists include economists, lawyers, architects, urban planners, and whatnot. But health officials are not given enough representation among these decisions. And that's why many of the built environments, though they look very beautiful, are not that very beautiful. And this is not only scenario in India, it is everywhere across the globe. So that's why more of the health officials need to be engaged into this built environment concept. And that's why this is the way how this CVPR can be harnessed in this, that it can improve the acceptability. It can, by knowing the reason, what are the problems associated with the community, we can improve the access to built environment. We can generate adequate advocacy that to have more subsidies, more facilitations for a built environment. For example, Madan Raj just told that we can have more facilities for solar electricity generation with the houses. So that kind of things can be facilitated. And most importantly, the awareness can be generated among the community as well as stakeholders that built environment does have a role in health. And that's the way we can harness built environment and CVPR to improve the health of the population. Thank you. So if there are any questions, queries, we can interact.
Thank you. I think it was great to know the built environment concept and how the health people or the health agencies even left out from the planning stage, which is of crucial importance, I think. One thing I was just wondering that because when we deciding about the built environment, so how much community engagement is you see it as a most important, because it otherwise this other stakeholders just become a part like designer, planner, economist, because they have to see their maybe their vision for that particular thing. So again, community is taken as a passive. So how much you think that a community, and what are the areas where community can be engaged in this kind of built environment things?
Yeah, that's a very important and nice query. Because of shortage of time, I couldn't elaborate it there. But this is my opportunity that definitely when it's a primitive behavior to build environment, and you know that whenever people try to build their own environment, it is usually an unplanned kind of thing. So what is important is there should be a linkage between a technical planner and community stakeholder. And this has to be facilitated by the health official, that it should not be only sustainable, it should not be only beautiful, it should not be only lavish, but it should also engage some health components. For example, whenever we are developing a newer colony, it is always ignored that there could be mosquito breeding places in the same new colony. So a health planner person can definitely advise them accordingly. Then health planner can also guide them that how can they make the same environment with better physical activity areas. They can spend less amount on the other things and allocate some budgets on physical activity areas. So this has to be a teamwork among planners from other disciplines, community members, as well as the health planners. And among this, it is most importantly that community should be engaged in this, because everything cannot be acceptable to everybody. For example, if I believe that swimming pool is good for health, but if that community is not believing in swimming pool and they don't believe that women can go to swimming pool, so that facility will not be utilized. So either we have to motivate them to use the facilities, or firstly we have to see what are the facilities that are acceptable for them. So this is the way we have to do research in this, that what interventions are acceptable and what interventions are needed. So,
Yeah, thank you. I think it's interesting because, we work in community, like small example of Narega. A lot of infrastructure, a lot of built environment is coming up. Even the sports ground are being constructed. But unfortunately, they are just constructed, no ownership from the community, and then they are in a dilapidated condition. It's almost like destroyed sooner or later. So I was just wondering if, until honest, for whom we are going to kind of go for the built environment. I mean, I'm taking one example of playground or any infrastructure being developed in the community. So if the ownership is not going to come from the people side, so we actually fail at all of both ends. The government or the agencies also fail at in terms of providing that service or delivery of those infrastructure, and community failed in terms of owning it. So ultimately, it is a loss. It's a no win-win kind of thing. Yeah. So this was just a thought. Yeah. Thank you.
Thank you, sir. Any other queries? So thank you. You can get back to me if required.
Thank you.
Thank you, Dr. Shabde. Thank you very much.
Do I need to do something from my end, sir?
You have to close your presentation.
Yeah.
Stop sharing.
Yeah. Thank you.
Okay, so built environment is something which is there for with us, but it's very in a way a new area, how to link those with to address current environmental health situations. But I think improving in built environment can also improve our living standard and our health as well. So now I think I can't. Sorry. So this is our last presentation for this session on environmental health inequality. We have had session on air, water, soil, climate change, introduction to environmental health, and built environment. There are many areas which are beyond environmental health or public health professionals, but it contribute in setting agenda for good health and well-being. So what in this short presentation, I will just like to discuss two things, social determinants and environmental health. And environmental health inequalities, what are those and how they impact our health and well-being. And in the last slide, I will share how CBPR can be useful in this to reduce the environmental health inequality. So I would like to start reading this short paragraph. Maybe you have experienced this as well in your neighborhood, in your locality, in your city. Our children have dramatically different life chances depending on where they were born. In Japan or Sweden, they can expect to live more than 80 years. In Brazil, 72 years, India, 63 years, and in one of the several African countries, fewer than 50 years. And within countries, the differences in life chances are dramatic and are seen worldwide. The poorest of the poor have high level of illness and premature mortality. But poor health is not confined to those worst off. In countries at all level of income, health and illness follow a social gradient. The lower the socioeconomic position, the worse the health. So, as pointed out in Dr. Madan Raj's presentation, also in Dr. Yogesh Shabd's presentation, that there are some vulnerable group, there are some location, there are some groups who are more prone to environmental health risk. So how can we live healthy lives, or how the health, on which aspects health are dependent? So it depends on our lifestyle, our daily routine behavior, nutrition, what we are eating, in some way genetics also, medical care, drug services, what type of health system we have, and also the environment where we are living. So how can we live healthy lives? There are other important area. There is also national and local policies. What are the current policies about health, environment, livelihood, employment, educations? It affects our health, our lifestyle behavior. Information media role is also very important. Family biography, genetics, as I told you, health services, material and social deprivation, quality of environment also affects our health. As we know that health and disease are socially determined, but also affected by environmental risk. There are environmental factors that is responsible for our health and well-being, and this is all we have discussed in the previous section. One is air pollution, noise levels, weather extremes and flooding, waste pollution sites where we are living, road traffic injuries, also drinking water quality and sanitation, inadequate housing and indoor pollution, harmful energy sources, and access to environmental resources such as green or blue spaces. So, and not everyone we are exposed to these on the same level. As I told you before, socioeconomic status play an important role in shaping our risk to these environmental related problems. Just a second. So this is one slide which I would like to show you. You can see clearly that death per 1,000 people attributable to the pollution. You can see that India or South Asia, part of Africa are more prone to air pollution deaths, in spite that we are we produce less greenhouse effect compared to the developed nation. But due to our status, due to our limited income, due to our housing condition, due to other socioeconomic condition, we are more prone to, in this case, air pollution death, but other environment health conditions. So what are the environmental disparities which is important? So safe environment are prerequisite for health and well-being, which is still not in agenda, not in priority. Environmental conditions are not the same everywhere and for everyone. So we need to be very clear on this, that intervention or things should be more localized, regionalized, because the environmental conditions are not same at everywhere. So we can't have one box fit for all. It depends on the local and regional environmental conditions. Disparity in distribution of and exposure to environmental risk occurs both between and within countries. So there is disparity within country, but also between countries and within countries. So in India, even each district will have a different disparities, or state will have different distribution disparity because the environmental conditions are different. The uneven distribution of environmental risk within society and the related impact on health and wealth equity are there of increasing concern. So what we need actually in terms of research data is collecting, analyzing, interpreting the local environmental risk, or the risk coming from the local environmental conditions. That is very important, and you can relate, or you can think about that, how the CBPR methods can help us in collecting those information locally. Then environmental disparities, this is some of the data, which an estimated 12.6 million deaths each year are attributable to unhealthy environments. Environmental risk factors such as air, water, and soil pollution, chemical exposure, climate change, and ultraviolet radiation contribute to more than 100 diseases and injuries. So what I mean to say with these figures, that environmental risk factors play important role in our health system, in mortality and morbidity of the population, and where the disparity are more, the challenges are more, or the risk are more. So what is the environmental inequality? Environmental equality results from the unequal distribution of risk and benefit that stem from interaction with our environment. Environment, as informed in our first session, that it may be social, it may be political, it may be economical as well. As informed in our previous presentation, residential options, residential characteristics, impact of toxins, impact of stress, all are interrelated and play a role in deciding our environmental exposures. So there are two words which I would like to describe, which is, one is equity and another is inequality. Equity reflects the political goal of achieving equal condition and equal opportunity, referring to equity in health outcome as well as health risk and determinants. And equality reflects any differences and disparity in relation to environmental health inequality. It signals differences in exposure to environmental health risk and related health outcomes. So this is one example of equality, you can you can see in this picture, equality is sameness, equity is fairness. So giving everyone the same thing, it's only works if everyone starts from the same place. Access to the same opportunity. We must first ensure equity before we can enjoy equality. This is very important. So we could not say that if we provide same type of education, same level of health care, same living condition, then it is, we call it equity, where fairness, access to the same opportunity for everyone. It also and then you can have numerous examples you can think of where fairness is not done, and even in your own locality, neighborhood, you can see that slight change in environmental condition are also responsible for change in health and well-being of those individuals. WHO has set up this framework on social equalities and environmental risk. This looks quite simple, but it's not that simple. But there are driving forces, increasing social disparities and stratifications. Then there are inequalities by socio-demographic determinants, income, education, age, occupation, migrant status, and gender. And then there are environmental condition, exposures, health effect, cost. Then also there are disparity and inequality in preventive environmental and health services, access to and quality of health services. So there are many factors responsible for inequality, and environment play a very important role in this. And the supporting factors, as I told you, income, education, age, occupation, migration status, gender, etc. So there are some area which I think that is important when we talk about CBPR in our next sessions. Environmental health equity affect us in getting basic services. Urban environment and transports are very important. Injuries and housing conditions. There is inequalities in environmental risk related to gender. The effect of environmental tobacco smoke have serious implication on girls who are more vulnerable than boys to the impact of smoking on respiratory symptoms and lung functions. Women may be more often exposed to chemicals at home and at work, while men tend to work in more risky workplaces and suffer more frequently from unintentional injuries. So there are inequalities which is related to environmental health or having more risk, but also related to gender. This is also one area which is not much worked on when it comes to CVPR. One of the example, air pollution affects everyone, but there are inequalities in exposure and the greatest impact on the most vulnerable, as told in previous lectures also. Older people, pregnant women, children, community with poor air quality, and those with cardiovascular disease and or respiratory disease will have more impact on air pollution effects. Lower socioeconomic group in dwellings, in the environmental tobacco, smoke, biological and chemical contamination, indoor air pollutions, thermal comfort, sanitary equipment, injury risk. In residential sector, lack of urban amenities and public safety, noise, proximity to polluted areas, and waste disposal sites. In the transport sector, especially with reference to road traffic injuries, in the workplace, occupational injuries, exposure to harmful substances and stress. are there. This is one of the example of inequality. I'm just giving one example of water, sanitation, and hygiene. The main dimension of inequality is how much quantity and quality of service you are getting, in which, if you are living in some specific part of the city, where you are living, urban and rural differences, income, poverty, and social exclusion. You can have, you have observed these inequality in your own locality, in your own city, where not everyone get same type of water, sanitation, and hygiene facilities, and it depends on where you are living. Are you willing to pay? What is your socioeconomic status, etc. But what action is required? Provision of adequate water and sanitation services at all the places, irrespective of their economic status. But that is still a caution. Housing. Main dimension of inequality is income and poverty, household composition, migration status, access and quality of the social housing services. This is what action is required. Regulations and standards, financial support and incentive, which has been done in some sectors, in housing sectors, where government is providing subsidized housing thing, but still a lot more to be required. Air pollution, again, depends on your residential localities, your income, poverty, and social exclusion. We need intervention to target local air quality conditions, irrespective of the socioeconomic status of its residents. Exposure to chemical, it depends on your education status, economic status. Development of effective production standards are important when we talk about exposure to chemicals. Waste contaminated site. Main dimension of inequality is distance to landfills and contaminated sites. What action is required? Fair distribution of waste disposal sites, environmental remediations. So these were the few examples where things can be, intervention can be developed, focused, and all you have seen. All these examples are the community is in center. So just providing a physical infrastructure will not work. You have heard about sustainable development goals. So what sustainable development goals told about inequality? So there are many points in SDGs where they are talking about inequality, but ensuring equal chance for health and well-being at all ages, reduction of disease triggered by environment conditions are important. So no poverty is one SDGs which is talking about inequality, and then SDG number 10 is in whole talking about reducing inequalities, and the focus is national, international, regional, and locally. What can we do to reduce environmental inequality? There are some points which I thought is important, but there can be many more, like addressing the social determinants of health. Very wide topic, but it can reduce inequality. Identification, pollution hotspot and contaminated sources, intersectoral collaboration. So not only health sector, but other sector also we need to take on board, both other sector as well. Integration of equity concern, need assessment and recognition. We don't have even the primary data on inequality, environment related inequality in many parts of our country. So that need assessment is important. Targeted intervention is required. And then again, focus on SD, social development of health. And there may be many more ways where inequality can be addressed. I'm talking about environmental inequality. So these are the some area which we can as a health professionals public health professional can focus on in terms of research as well. Goal number 6, clean water and sanitation, important. Goal number 3, affordable clean energy. That is also can reduce inequality, ensure access to affordable, reliable, sustainable, and modern energy for all. Make cities and human settlement inclusive, safe, and resilient and sustainable. And ensure sustainable consumption and production pattern. That what we talk about organic farming and other things. So these are the few areas of few sustainable SDGs that we can focus when we talk about inequality, and these are also area where CBPR methods can be applied at different levels. So this is my last slide about role of CBPR. Improvement in environmental conditions, how we can improve environmental conditions using CBPR techniques. Mitigation and reduction of risk exposure. This is very also important. The first thing is that, are we aware about the risk? What are the risks? CBPR methods can more in simple way, friendly way, can inform the consumer stakeholders about the risk. CBPR method can also help us in assessing the health inequality. Partnership is very important pillar of CBPR, where the experience are shared. And monitoring of environmental health inequalities can also be done through CBPR methods. So these are the few areas which you can think further when you develop your proposal, or when you listen to lectures, the next week lectures on methods for CBPR. So what was the take-home message? One important thing is that environmental health related inequality exists, and it is very much exists, and you can see it everywhere. The magnitude of inequality varies largely, depends on where you are living, or your socioeconomic conditions, other factors. Integration of socioeconomic indicators in environmental health monitoring system is very much important. Normally, as a public health researcher, or we normally tend to ignore the socioeconomic indicators, but these are very much important. And development of indicators of environment inequities or inequalities also not there in most of the cases. So thank you very much for this. And if you have any query, any comments on this topic, you're welcome to talk or give some comments. Thank you very much.
Thank you, Vishal. Yeah, just one thing. I mean, don't we think that we now a time is there that we need to even broaden that definition of environment beyond the soil,
Yes.
or water and all, in terms of like when we say environment, very commonly in the layman we say that home environment is not good because people are not cohesive, they are not living happily, the communities are not conducive. So broadening the definition of environment, where even in the WHO definition we have when we talk about the health, it is like a spiritual well-being, that individual subjective, more subjective kind of contentment and satisfaction, even beyond. So when you mentioned about the socioeconomic status improvement, so I don't know that may not be the kind of thing which will lead to the better health or better environment, in terms of until unless the person is not going to decide a limit. It's again going back to the basic definition of our scriptures, and as Mahatma Gandhi ji also reinforced, need versus greed part of that the whole world is also not enough for my greed. Need, I mean, the whole world can provide me many things. I mean, just thinking thoughts coming.
Yeah, very, very true. I think in our first lecture of Dr. Tiwari also, he has mentioned not only physical environment, but we normally as environmental health people, we think in those compartment, that air, water, soil, but definitely without considering the socioeconomic status, without considering the home environment, without considering your neighborhood environment, where you are growing up, where you are getting education, what type of school, who is teaching you. All these comes in the environment. I think we have tendency of comfort, like to work on this one direction. That is creating a problem, I think. But it's also changing. The researchers are coming where they are taking an integrated approach of defining an environment. You are very true in that. We need to broaden our thinking, and in our project per se, in our in NIRE, what we are doing is we are not only just focusing on physical environment, air, water, soil, but we are also focusing on the behavior part. Why people are not doing this, or why people are doing this? Is there any effect of their education, their neighborhood? So we always keep those information also, or collect those information and try to relate. But still, and you can see the climate change or other problem, it's not just about a physical environment. It's there are many other things that has increased our problem. Low socioeconomic people or country are suffering more than other countries. So I think it's quite important and true that we should also take care of other conditions, or include SD social determinants and other. I think it's in many institutions are working in that approach, but still it is lacking.
Yeah, I think the institution, this kind of, focusing in this domain as well, which is very, I mean, it's like maybe human behavior, and these are very subjective kind of thing, right? But I think it's like, what I'm going to give to my children. If I'm more of a consumeristic kind of, or those kind of things, so definitely I'll also pass on that to the generation next. So
Yes,
how to
yes.
bring in, how to build that in the research acumen, because academics and research are also have a lot of weightage in terms of policy, driving the policy and all. So how to bring in that? Are institutions open for that? I'm just asking.
Yeah. So what I will say that I think this behavior thing is it seems that it's very much it's a social that is true, but it can be studied in a systematic way. That I would like to tell you. We have some example in our own settings. We are working on a randomized control trial on waste segregation at source in household. So when we approach these household, they said that why are you coming to our house? It's a municipality work to do the waste things and all things. But when we said, tell them that no, the source segregation is your work. The rest work is of municipality. So some people are wondering, okay, is this our work? Should we so segregate or not? That is one thing. So no one has actually, it's a limited information are provided. So if the residences know that, okay, this is segregation is my work, and rest municipal is they are doing properly, then it's okay. Second example is providing safe drinking water. In many instances, the state governments are saying that we have provided a pipe water supply to schools and houses. Other thing is, are they maintaining? Who is responsible for maintaining this? There are many instances we have seen in our research that the schools are provided with best quality of infrastructure for water sanitation, but after some time, there are people, either they have broke it down or water is not coming. So the responsibility also lies with the community, that if the service is provided, we are also responsible to maintain it. At the same time, the person who is providing the service should also talk to the stakeholder by मैं ये सर्विस लगा रहा हूँ, is it right place, right location? If I have put my water connection somewhere outside the village or something, and I'm not using, or I'm only getting 10 minutes of water. So, but if it is done in consultation with community, I think the community are quite smart, intelligent. They don't want to destroy their own resources, so they want to keep it. But many times we do not communicate in that.
Yeah, it is
range.
unfortunately, it is more of like, we will like, I think in the last class I was mentioned about the Jal Shakti mission, where
Yeah,
we
yeah,
say that
Jal
Har
Jeevan
Ghar
Mission.
Jal, Har Ghar Nal. People
Yeah,
just think that it is a Mr. Prime Minister's responsibility to provide tap at my doorstep. I mean, that's like, but we are not going to take care of our water sources, or, then we have to leave that all. That's not going to work at all. We know that it's going to somewhere coming up with a big problem, which is happening. Yeah. Yeah.
that is very true.
Yeah. Yeah.
All these questions are, I think it's quite basic questions. We need a new approaches to communicate with the stakeholders. That is what my last take home message is. Thank you very much. Is there any other comments?
Thank you. I'm fine. Yeah.
Okay. So thank you very much for this 2 session. I hope you have some more understanding about environmental health situation scenarios, areas where there are more intervention is required, and then maybe you can now read your assignments or the content in the dashboard. Please, the discussion forums are compulsory to do. Please discuss those, and good luck for your session 2. Thank you very much.
Thank you. Thank you, everyone.
Thank you. Thank you, sir.
Thank you.
Thank you. Bye.